All right, well, speaking of health, the doctor is in the house. A new report from the American Cancer Society released this week, you probably heard of it, showing that the overall risk of dying from cancer in the U.S. has continued to decrease. Some good news there, right? But the number of new cases are increasing, and it's expected to top 2 million just this year. Joining us live to give us more insight, Medical Director of the Scripps Cancer Program, Dr. Thomas Buchholz. Thanks for coming in, Doctor. I always appreciate your time.
Thank you, Eric.
All right, let's talk about the good here, the trends that we're seeing from this report. What did you like about this report and the direction we're headed when it comes to cancer in the U.S.?
Well, most importantly, we're seeing fewer cancer-related deaths in the United States.
Yeah.
And it's really been dramatic over my professional lifetime. In the past 20 years, almost a third fewer cancer-related deaths, translating to 4 million lives saved.
That's incredible. When you think about 4 million lives saved, what do you attribute to this decrease mostly?
Really three components. All of them are equally important. Number one, cancer prevention. Things like tobacco cessation, sunscreen protection to avoid the risk of UV radiation. HPV vaccinations have certainly made an important advance in decreasing cervical and now head and neck cancer related things. Secondly, early detection.
Right.
It's really important that we diagnose cancer at an early stage, and there are well thought out prevention and early detection strategies for breast cancer, colorectal cancer, prostate cancer, skin cancer. And just recently at Scripps, we've employed a lung cancer screening program to address the number one cause of death, lung cancer. And that's for people over the age of 50 with a smoking history. And then finally, advances in treatment. The treatments keep getting better and better in cancer, and we're seeing patients with previously incurable disease now being able to be cured.
Fewer people are dying from cancer, but the overall number of cases rising. What's the reason behind the rise in case numbers?
Well, the cases rising, that 2 million is a scary number,
yeah, it is.
But last year was 1.9 million, so it's a slow incremental rise. And in part, it's due to the aging population, which of course is a good thing. If we have decreased competing risk of dying from cardiovascular illness, we're more prone to get cancer as we live longer.
Sure, that makes sense.
But there are some lifestyle modifications that we can do to help prevent cancers, and things like diet and exercise and avoidance of obesity now, in addition to continued efforts to decrease tobacco, are really important.
For people at home that want to, not be a statistic, what can they be doing on their own to help, avoid cancer?
Well, again, healthy lifestyle modifications, and the important things now in the United States are diet and exercise and avoidance of obesity.
Right.
Clearly, tobacco is still the number one carcinogen, and also HPV vaccination we want to promote. And then really try to detect cancer early. Really adhere to screening recommendations. And as I mentioned, for instance, in lung cancer, only about 5% of the eligible people for lung cancer screening actually receive that. So that's a big effort now that we're doing at Scripps.
You got to be proactive. You got to go in. You've got to do the work, stay healthy, but also check it with your doctor and get that preventative. Is there a website we can send people to so they can learn more about cancer and at Scripps and how you guys can help?
Scripps.org. Very simple, or 1-800-SCRIPPS. We offer free screening for healthcare disparities and breast cancer and cervical cancer and other things. Please reach out.
Good to know. Thank you, doctor. Appreciate it. Good to know that stuff. Stay with us. Take a quick break.